I will call this meeting of the Fargo-Cass Public Health Board Health to order. I am sitting in for President Matter today since she is in warmer climes. Lucky her. I would entertain a motion to approve the minutes from the last meeting date.
So moved.
I'll second.
Okay. Any discussion?
Yes, just one comment here. It's got me as both present and absent. I was present on the 13th. I was probably absent-minded, but I was here. That's all.
Okay, on which one?
December 13th.
December 13th. I also noticed that I was not here on December 13th either, so if you want to put me in absence, that would be great. Okay, so we have some amended minutes. Any further discussion? All in favor of approving the amended minutes from December 13th and October 18th, please vote by saying yes.
Yes.
Any opposed, no. I think we're good. And then I am going to turn this over to Grant. He is going to make some introductions for us.
Yeah, thank you, Robin. I'm sitting in today on behalf of Desi. She's up works doing some work. But the first thing she wanted me to do is welcome the new board members. Kayla Nelson, who's going to be filling the medical provider representative position. And she's from Family Healthcare, as well as Amy Lavella, and she works for Lakeland Mental Health, and she'll be filling the behavioral health representative. At this time, just to give the board a little background, could you just fill us in with a little bit more details of your personal background, please?
Are these on? Okay. Yeah, so I've been an NP with Family Healthcare for almost 4 years. Is everyone familiar with Family Healthcare? What we do? Yeah, so basically anything you can think of medical-wise we do. I do a lot of refugee health. Also, one of the big projects I've been working on over the last year and a half is treating hepatitis C in primary care. And doing a research project on that with some folks at NDSU as well. Also do a lot of substance use treatment. And I got my doctorate at NDSU.
And so I work at Lakeland Mental Health. I'm there full-time, and then I also do part-time telehealth work out of SLV Group, which is located in Fargo. I've been with Lakeland for 3 years. Prior to that, I was at Prairie St. John's. I worked in their hospital and in their clinic as well. So behavioral health, I work with individuals with all sorts of mental health disorders, substance abuse issues, depression, anxiety, bipolar disorder, all sorts of other things as well. Do a little bit of therapy there, and I got my doctorate from the University of Minnesota.
Perfect. Thank you for sharing some background. I don't know if you had the pleasure of meeting everybody else on the board, so why don't we just go, starting with Larry, why don't we go down and just introduce ourselves to the new members, please?
Okay, welcome. I'm Larry Annenson. I'm the Director of Health Protection and Promotion at Fargo-Cass Public Health. I oversee our public health clinic, our health promotion area, as well as employee health. So, and again, welcome.
Dr. Heidi Lako-Adamson. I'm the health officer for Fargo-Cass Public Health.
I'm Lynn Telford. I'm the community representative and then also a nurse at Sanford Health, and I've been on the board for about 1.5 years.
Mike Thorsted, West Fargo City Commission representative.
John Strand, Fargo City Commission.
Robin Nelson, Fargo School Board.
Rick Steen, Cass County Commission, and currently the Portfolio Commissioner for Cass County Social Services Zone Board.
Grant Larson, Director of Environmental Health at Fargo-Cass Public Health.
Melissa Parola, the accountant at Fargo-Cass Public Health.
Go ahead, Lori.
Lori Sal, I work for Fargo-Cass Public Health.
Okay, thank you. And on behalf of Fargo-Cass Public Health, thank you for everybody and their willingness to serve on this board, especially the new members. We welcome you to the board. Thank you, Robin.
Very good. And we don't need a motion to have them join the board? That's not, okay. Some boards work differently than others, so welcome, ladies. Very impressive. Next item on the agenda is the budget. Melissa, would you like to lead us through that?
Sure. You have before you both 2009, the last numbers, not officially because there's a few trickling in, but they're pretty small, and the budget and what's come in so far for 2020. the end of December for both revenues and expenses, we ended the year really well. Revenues at technically 100%, 99.7, and expenses at 97.7. So job well done by all of our staff at Fargo Cass Public Health for managing their budgets incredibly well. I wasn't really going to point anything out unless you guys have any questions. Well, I guess I'll take that back. Revenues in 2019, one thing I wanted to show you down in the third section down, local, we have withdrawal transportation program, which is the MOP program. We had listed $110,000. That's what we were expecting to get, or hoping to get from our partners in the community, but we ended up getting $290,000 from North Dakota Department or Human Services for the same program. So we didn't need participation from those other partners in the community because that took care of it. And coming into 2020, they actually granted us another $290,000. It's not currently listed in the budget because the amendment came through and we didn't know we were getting that till just a few weeks ago. So we'll have another budget adjustment for starting 2020 right off the bat with a 4% increase in both expenses and revenues. Let's see. I don't know, do you have any questions? Do you want me to walk through anything in particular? Anything that you have questions on that kind of jumps at you? There are some numbers from on the expense side for 2019 that I could go through if you have questions about why they seem so high. And again, and overall, we managed to keep it under 100%, so I think we did okay.
Any questions for Melissa? Okay, Grant, you'll have to catch me if I miss asking for any actions, okay?
Sounds good. I think you're good.
Agenda item number 3, server training evaluations, and Larry and Preston are gonna present those.
Yes, thank you. Good afternoon. During the August 16th Board of Health meeting, there was a lengthy discussion related to server training as well as our alcohol compliance check. It was at that meeting that the Board of Health reaffirmed its support of server training and the classes being offered by Fargo Cass Public Health as well as the Fargo Police Department. Fargo Cass Public Health appreciates the continued support, and we felt that it was important for us to give you an update on the evaluations from their server training classes from 2019. Preston Niesmeyer is a community health educator at Fargo Cass Public Health, and he does an outstanding job coordinating server training as well as our victim impact panel, and he put together a presentation that he would like to share with you related to our 2019 evaluations. So with that, I'll let Preston take it away.
Good afternoon, everyone. Like Larry said, my name is Preston Niesmeyer. I work at Fargo Cass Public Health. I've been there a little over a couple years now, and I recently took on this role with server training and victim impact panel about a year ago as well. I do some work in tobacco prevention as well. So we're going to talk today a little bit about our server training evaluations. These evaluations run from January 2019 through December 2019. So a little background on what server training is. This is required by a city ordinance in Fargo, West Fargo, Horace, Glendon, and Moorhead. This helps servers learn understanding, complying with the law. It'll help them detect and deter underage drinking, what to do if a underage patron walks into an establishment as well, what to look for, as well as servers actually get to handle and look at fake or false IDs that have been taken from local establishments. So in 2019, we had 67 classes held. That includes private classes as well. Establishments, if they want to, can do a private class if they have over 20 individuals that need to take the class, and we'll do the class at their establishment. Just a little background, the class is taught by local PD between Fargo and Moorhead and the Sheriff's Office. So of those 67 classes held, there was approximately 2,500 total learners. So 2,500 servers went through server training, whether if it's a first-time renewal or first-time class or a renewal. And we had a total of 41 online class renewals, and that doesn't count as part of those classes held. With this, with the last time when we talked about server training last year, we decided to increase class size to make it more available for patrons, as well as this year, most recently, we included a new class time doing it at 1:30 in the afternoon, and that class has been very successful because you're getting the servers getting in there before they actually have to go to work, if they have to work at 4 o'clock, 5 o'clock to work at their local establishment. So here are the numbers. We ask the servers to do an evaluation post a class. The first two are related to the registration. So the pre-registration process is quick and efficient. With that, over 97% strongly agree or agree. So they can either sign up online or over the phone. And recently, I could envision this number even increasing a little bit higher than that. We recently had a revamp of the server training website, so it's going to allow establishments to register multiple people at once, as well as do a little bit better with their tracking. The sign-in process was quick and efficient. This is when they come in and take for the class. We like for them to get there at least 15 minutes before, but as you can see, 96% strongly agree on that. On the third question is, to me, the content of server training is just about right. That had a 98% strongly agree or agree with over 2,300 people taking the survey. So the next round of questions was, to me, the content of server training was, was that one? Right, it was training was right about right. So that one had right about a 98%. Success rate for strongly agree and agree. The next question is, the class meets my needs for knowledge and information and required to legally serve alcohol. So our class, why it's required here, and we don't accept other server training outside of Fargo, because our server training class will pinpoint and highlight city ordinances that are in Fargo and West Fargo and Moorhead. And with this one, you can see that we had about 96% strongly agree that the class met their needs on that. The next one, the class taught me how to identify minors trying to purchase alcohol. This question had a 96% strongly agree or agree on that question. Because then during our class, the officers will talk about what to look for, such as if they go into with a group of people, will the oldest person go to the bar and try to order all the drinks? Are they going to the back of the restaurant so they're less seen? And they go through different situations and how to deal with that when a minor does attempt to go into a alcohol establishment. So the next round, the ID checking procedure I learned in this class was very helpful. Here we had a 99% strongly agree on this one. I think a big point on this one is we have a bunch of different slides that go what to look for an ID, how to recognize if it's a fake ID, are they using someone else's ID, going through like facial recognition, looking at the eyes, the cheekbones, and so forth on that. Also having them be able to actually handle fake IDs is extremely beneficial for them, because the fake IDs now are really good. We had an establishment that came in because they had a fake ID come through their bar, and they brought it in just to see, because it's scanned, because all the fake IDs now do actually scan, and it'll bring up your information as someone who is older. So with them being able to handle that and what to look for, and it's very minute detail to pick out what IDs can be fake. The next one was the class emphasized the importance of monitoring customers for intoxication before every sale. On that one, we had about a 97%. People strongly agree or agree on that. This is just looking for signs of intoxication. Are they glassy-eyed? Are they slurring their speech? How's their gait, their movement? So servers aren't get in there and overserve someone and potentially affect with like a dram shop law if they got into a car and got in an accident. The next question is, the class taught me some important intervention techniques for intoxicated persons. On this one, we had another, again, a 99% people strongly agree on this. Within the presentation in person and online, there's a 10 steps to intervention that the police will detail on that, like making sure you're not going to get pushy with them, you know, and try to cause a ruckus. And you don't want to upset that customer because it may lead to other issues as well. So the last round of evaluations here, so another one here, both North Dakota and Minnesota laws were clearly presented. Here was a 99% agreement on that one again as well. Like I mentioned, we go over local ordinances. This was why we don't accept online training from the bigger outlets like TIPS, or we don't accept like a server training card from Grand Forks. If they do have a server training card from Grand Forks, we allow them to renew at Fargo Cass Public Health for the $5 price. They don't have to pay the full price as long as they represent their card. But we do cover North Dakota law and Minnesota law because they do differ. In Minnesota, you only need to be 18 to dispense alcohol. In North Dakota, you have to be 21 to be behind that bar. The next one is the instructor was easy to follow and understand. This one, again, we had over about a 99% strongly agree or agree on that one as well. All our police officers that do handle the class, they do an exceptional job. They keep it lighthearted and they make it, you know, they bring in some jokes and get people to laugh because they are there for about 2 hours, but they actually have real case scenarios because many of these officers have arrested people for over 400 DUIs. So they know what they're looking for and they make it relatable for those servers between the communities. The final one here, an instructor presented the information in a manner that allowed me to focus on the materials. Once again, we had a near perfect example of here, strongly agree or agree. I think this just helps because these officers who have been teaching the class, many of them doing it for years and years and years, so they know what they're looking for and what the servers and bartenders, what they should be looking for when they're serving their alcohol or dispensing it. So here's just some of the server training evaluations, some of the comments that we get. Just to point out some here, it's been 6 years since I've taken this course and it comes leaps and bounds in terms of current relevancy. Another one here was nice to see that an afternoon class was offered. We didn't know how well that class would do, and so we just tried it out, and it was the first class got booked out. We booked a class to 60 people. The instructor did a great job with real-world examples that kept the material interesting and easily applicable to other situations. And the class was full of great information, lots of fun examples, and made it easier to understand and remember. So like Larry mentioned, we're very proud of our server training class. We hardly ever get, and I rarely see comments because I have to read through every comment and log it, that no one ever mentions that they wish this class was just offered online. They love that we do it in person. And many times, as you can see from the presentation, we don't have a lot of people renew online. Majority, I would say 2 or 3, 4 times more people actually come back to the class and take it than do the online module, because they get that in-person interaction and get to ask police officers questions. Does anyone have any questions regarding our 2019 server training or going in the future? Yes.
Thank you. A couple of questions.
Yep.
If you confiscate a driver's license, a fake or false ID, what happens to it, and what action does that trigger?
Well, if the bar does it, they have to, well, if they take someone else's ID, they have to contact law enforcement within 24 hours. If they take a false ID, it goes into the evidence locker at Fargo PD, and that's how eventually we receive some of them. If they were going to destroy them, we can take them.
Do we track what the PD does?
What's that?
Do we track what the police department does, what their subsequent actions are?
Not on that, no. Usually, that'd be a good question with the Fargo Police Department, but usually they would I don't know what the citation would be for a minor using a fake or false ID.
We would assume there's action, otherwise it's a waste of time.
Right.
Another question is, for those who don't comply with the proper training, what are the consequences or ramifications to
So
those
city,
businesses?
So city ordinance says once a trainer is, someone is hired, they have 90 days within their hire date to get server trained to be able to work there, but there is no like a city penalty for a server if they do not complete server training, or there's no like big or penalty on the business, right, currently.
I think we talked about this in August, about what is the motivation for people or businesses to ensure that their trainers are up to date on their license. Did we not?
Yes, we did talk about that, and I know currently the auditor's office, the office that does issue the liquor license, have been in contact with the police department, with city attorneys, just to talk through the penalty structure and see how we can update that, just to ensure that more and more businesses are being in compliant, with the server training requirement.
I have a question. How often do they need to renew their training?
They have to renew it once every 3 years.
Very good.
And then the second time, they can have the choice to renew online if they want. But then the third time, they would have to go back into person.
Any other questions? Thank you, Preston.
No, thank you.
Back at Larry, update on T21 federal law.
Thank you. At previous board meetings, we discussed e-cigarettes, tobacco, and ways that we can educate the community on e-cigarettes, the harmful effects, as well as focusing on preventing youth initiation to those products. Since our last board meeting, the federal government has helped us with that task, and they in December 2019, Congress passed a $1.37 trillion spending bill, which included a provision to raise the minimum legal age to purchase e-cigarettes and tobacco products from 18 to 21. Upon the president's signature on December 20th of 2019, the age change became effective immediately. And what that means is it is now a violation of federal law for any retailer to sell a nicotine or tobacco product to anybody under the age of 21. The law does not have a phased-in restriction or grandfathering if individuals were 19 or 20. There isn't a phase-in. The businesses cannot, against federal law, sell those products to those individuals. There is no exemptions to individuals who are in the military that are under age 21. And currently, we have been working with our city attorney and discussing how we can update our local city ordinance to reflect the federal law from 18 to 21. So soon, I am thinking that there will be something brought forward to the city commission level related to updating our city ordinance to reflect this change. And that's the update that I have for everybody today. If anybody has any questions.
I wanted to clarify, does that include e-liquids and vaping products for T21?
Yes, it does.
Okay.
It does.
That's some good news.
It
We're heading in
is
the right
really,
direction.
yes, it is really good news.
Federal government beat us to something.
Yes. But it was nice that we had some healthy discussion here at the board of health on ways that we can prevent youth initiation. And you're right, it was nice that the federal government did beat us to this.
Madam Chair, I know there's somebody in the audience that may want to comment, or maybe not. David, did you want to address the board?
I would love to if that's...
If you would go to the microphone, please.
Okay.
Sorry, but I think I know
During
he's
the
here for
public
that.
comment section, so.
Yep.
Is this microphone good, or do you want me to use the one?
Sure, that'll work fine.
Am I on? Okay, good, I'm on. So I thought as part of the vaping discussion, it would be important that we remedied some misconceptions from the last meeting because it led to some misinformation being disseminated and that could potentially cause a problem. I know some of the members of this committee were interested in a flavor ban, and as a result, I kind of wanted to give an update from the industry perspective where we're at. The first thing is people have been falsely, yes?
Dave, tell us who you are.
Oh, I'm Dave Owen. I'm here on behalf of E6 City and Sports Vape to kind of just discuss this with you guys.
Go ahead. Thank you.
So the first thing is there were claims that the products were marketed towards children. And in North Dakota, that's not the case. That has not been the case for a long time. The industry has regulated itself to the point that it's a mature industry. We've brought some samples of what our traditional liquids look like and how they're marketed. As you can see, it's black packaging, plain packaging. It has a label. It has a nicotine percentage. And all it basically goes into is what you're actually buying. I don't think something that says salted Michigan's finest is going to be marketed or catered towards children, quite frankly. I think these are reasonable, and as a result, I think the quote-unquote marketed towards children are overstated. Furthermore, there was some disagreement about the public health implications and what the CDC was and was not saying. Since the last meeting, the CDC has updated its position, as opposed to saying that you should not vape, to merely to avoid black market THC cartridges. And they have contended that that is the main source of the illnesses and outbreaks that have affected a large portion of the population that is sick. As of now, we don't have any deaths where THC was not found in the system, and in almost all instances, above 90%, we're seeing THC in their system. Furthermore, investigation by New York has determined the leading chemical cause of this, and the leading chemical cause is vitamin E acetate, which is not found in commercially available liquids. So where does this leave us going forward? Well, the city of Fargo and the city of West Fargo and Cass County as a whole has a couple of decisions to make. The first decision they make is, do they wait for the state legislature to create the rules, or do they attempt to create their own rules? I would suggest that you wait on the state legislature for a very simple reason. North Dakota people have transportation. And if you live in a small town, you're likely to have a vehicle. If you live in Fargo, the public transportation here is not great. Most people have a reliable means of transit. Assuming you were to pass city ordinances in either Fargo or West Fargo without, let's say, Grand Forks or Jamestown, or even a town such as Hillsborough, which is outside of Cass County, all you're doing is taking the tax revenue that would have been generated here and moving it to those locations. You're in many ways taking away your own ability to deal with the problem here by depriving your shop owners, who are very willing to engage with the committee and who have proposed suggestions on how to deal with these issues. You would be depriving them of their ability to operate while simultaneously moving the problem outside of your jurisdiction, which means ultimately you lose control. Furthermore, what's going to happen is if you continue to ban these substances, all you're going to accomplish is push people to the black market. As we previously identified, according to the CDC and according to the New York Department, the cause are the black market cartridges, and usually they're in addition to a vapor pen. So this is an example of a product that is currently designed to be used with nicotine vape. It's a vapor pen. We don't have the battery in it, and it has this little cartridge at the top. See how it's nice, it's metallic, it's fairly well made. Well, what ultimately happens is bootleg sellers, usually on AliExpress, have engineered something which goes into it, and like this. And they're utilizing the existing technology to create a black market THC vape. So people will buy these things by the thousands for a couple of dollars and ship them into the country, and from there, they then go and fill them with black market THC vape. And as you can tell, this looks very different than this. It's an inferior product, but more importantly, it's a product that's poisoning people. So what happens if you do continue down this road and the T21, you decide to enforce it early? People are going to go to the black market. And in the black market, you don't know what you're getting. Are you going to trust that the store is actually providing something reasonable? Well, when you have an actual store, you can do that. You can inspect them, you can hold them liable. The black market dealer doesn't care. He's breaking the law either way. Why should he care what's in his product? His goal is to maximize profit. And that's why we saw vitamin E acetate, and that's why we saw the illnesses that we're seeing. What we're asking from the industry is that you work with us and give the chance for these regulations to set in. The city of Fargo and the state as a whole have changed the regulations no less than 5 times in the past year. And it seems that you're reacting far more out of fear than out of science or best interests. One of the things that the industry is proposing is, why don't you come and create inspections for whether or not our liquids contain vitamin E acetate? We stand by our product. We believe our product is legitimate. So why don't you test it and see if we actually have a problem here, as opposed to just outright banning it? When you talk about quote-unquote concerns of marketing towards children, we don't understand what you're talking about when we look at our product lines. Perhaps clarify it. Simply having a flavor does not market to children. A chocolate flavor, for instance, could be something that a child would want to consume. It's also something I happen to be buying my girlfriend tonight. So at the end of the day, I think you're looking for what you want to see rather than what's actually there in the product SKU. But we're more than willing to work with you on what should our products look like if you feel that stuff like this is marketing towards children. Lastly, the industry is already taking actions to regulate and self-regulate. Most vapor stores in this state have pulled about 20 to 25% of their inventory as a result of both concerns that it's getting into the hands of the youth and also due to regulations that are existing from Juul and others. Flavor bans, while ineffective, are something that basically doesn't work, because at the end of the day, again, the industry knows what they're buying, and they're not buying it for the flavor. They're buying it for convenience and the ability to hide it. The refillable pods have now, as a result, been removed from the product lines of every vape store in the state, because we realized that, hey, maybe we should restrict that particular line of product. And so we've done that. I just want to end with the one other thing is the injury, illnesses, and deaths have been overstated to you guys. There was an individual last time who claimed that there had been 1,000 deaths in the United States. That number was patently false. It was between 60 and 70. I believe it was 68. So the numbers you're getting aren't representative. And I think her exact phrase was, if the flu were killing this many people, we would be jumping all over it, but because it's tobacco, we choose to ignore it. Well, I don't know if you've seen the statistics, but over the year, flu kills multiple times more than e-cigarettes have. And keep in mind, again, these were people who were buying black market THC cartridges, not legitimate products for sale. So I guess in closing, I'd be more than willing to take questions, and I'd just like to say, give us time to see if the regulations are working. Let us work with you. Don't push the stores out of business and push it towards a place where you have no ability to intervene. Don't create a black market where ultimately you have zero control.
Thank you.
Madam Chair, if I might. And I'm not sure, David, if you should answer this, or Larry, how does the internet fit into this new regulation and managing and regulating the internet purchasing? And
So I can answer half, and I'd love Larry to answer as well, but my understanding is China is not subject to US law, ultimately. End of discussion. As a result, when you order from AliExpress, you are theoretically breaking US law, but it's not going to be seized, it's not going to be searched sufficiently, because it's going to be masked with legitimate orders. China is fairly famous for doing this with computer parts, for example, to avoid the tariffs. They mislabel them as something else, they get through the ports, and then they get shipped, and no one's the wiser. If you're buying it under the age of 21, the person at the port is not going to know how old you are. And at the end of the day, the Chinese seller is not required to check because they're not forced to comply with US law. So ultimately what ends up happening is my buddy, let's say, who's 18, is able to order it on AliExpress. It ships. Technically, he's broken a law. Technically, AliExpress has broken a law. But at the end of the day, the enforcement is non-existent because the address is to someone who's of age, presumably, and because the company shipping it just doesn't care because we don't have any authority over them. And Larry, you can feel free to add to that.
Well, I am not versed enough to make a comment on that, but I do know that there are some safeguards in place to prevent some of the sales of products, e-cigarettes, and preventing them from getting into the hands of youth. I know that I have talked to a variety of individuals in the past with different ideas of checking IDs, some type of a mechanism just to double check that they are not selling to youth and youth are giving a fake age and so on. Could there be more done? probably. But again, without any research ahead of time, I can't comment very much on that.
Okay, so we went a little out of order in the meeting. Typically, we would, and that was nobody's fault. But as far as the back and forth, if we want to have some back and forth, I recommend that we have this on the actual agenda so it can be discussed amongst the official members. So thank you so much for your presentation.
Do you mind if I add
This
one
is on the agenda, Madam Chair. The federal 21, it's on the agenda.
Okay, I would view this under public comments. And so, the back and forth, if the board invites a guest, then I think that the exchange would be appropriate.
Understood. Do you mind if I very briefly address something that Larry was saying, because he made a very good point?
Sure.
For U.S. sellers, you're absolutely correct. U.S. sellers are attempting to find ways to regulate and determine that the products are of age. They will frequently ship them with age requirements. I don't know if you've ever had alcohol shipped to you, is the classic example. People will get it shipped to them from a winery. Typically when the man comes, you have to sign something and provide an ID, but that is usually at the discretion of the seller. And as a result, these foreign companies won't care. Are they technically violating the law by not doing that? Yes. Do they care? Not really. So I just figured you are correct for US-based sellers. And that's why it's important that we keep this market in the United States.
Thank you very much for your comment, sir. Okay, flood activities update. We would have Doug. Welcome, Doug.
Good afternoon, Doug Murphy, Emergency Preparedness and Response from Fargo-Cass Public Health, and I was asked to give an update of flood preparedness, aka evacuation. We work with, in Fargo-Cass Public Health Emergency Preparedness and Response, we work with agencies that house somebody overnight, hospitals, group homes, long-term care facilities, shelters. Not only in the metro area, but our region is the 6 counties in the southeast North Dakota. So we work with them on a regular basis to prepare for all types of emergencies, not only a flood. It could be a tornado, it could be a fire, or any type of evacuation. They could have a power outage and lose power, and we need to evacuate those people because it's 15 below outside and they don't have a heat source. Our goal is to continue, whether it is a hospital, nursing home, group home, whatever it is, shelter, is to keep them doing what they do. Our intention is not to come in and take over those clients or those customers. So a hospital gets taken off the grid. What can we do to augment them to keep them taking care of their individuals? So that is what we do. The North Dakota Department of Health has a medical cache or a cache of medical supplies and equipment, durable equipment, that is about $13 million. We do have some of that housed here. That is available to any healthcare entity that I've stated, those type of facilities. And they can pre-stage that stuff in a flood. A flood is different than a no-notice event, such as a tornado or a fire. For a flood that we have 6 months notice, they certainly can plan for that, and we have very methodical steps that we take. But they could pre-stage a lot of equipment here, if it's wheelchairs, stretchers, stair stretchers, that type of thing. Or if we need shelter for their facility, they can have that brought here. So we plan and we train and we do all that. We've recently brought all of those healthcare entities together and sat them all at the table, because that's what we do in our preparedness world, is we meet our partners before the need arises so they know who we are when the need arises. We've gone out to facilities to train them. There is turnover of staff, so we want to contain that. We want to maintain a current level of preparedness. We don't want to lose that and just say that we've prepared you and 3 years later you don't have it taken care of. There is no requirement. We can't make them drink the water. We can give them these tools. How they choose to use it is up to them, because every entity is still in control, and it's their residents or their individuals they care for. We do have state systems. When we do an evacuation, If it is one facility going to facility B, they're on their own and they can make arrangements to contact the other facilities in town and arrange that on their own. But when it is every facility in town that needs to be evacuated, we need to have a plan. We need to see every individual that is in their care, and we need to prioritize them. For example, you can't just say that facility A, you've got 6 people here at the door ready to go. Okay, hop on this bus, we're gonna take you over to here to facility B. And then we get to the end and we find out we've got a bariatric, or we've got a vent, or we've got dialysis, and now we're taking them to Mayville, North Dakota, and I'm picking on Mayville, but Mayville maybe can't handle a bariatric. They perhaps can't take care of a vent. They perhaps don't have a dialysis unit in their community. So now we've got to go to that facility we just took somebody to, move because they have less acute care. We need to now move them to Mayville because we have to make room for somebody more skilled. So we have to see that whole list of care, triage them appropriate care, and then place them. And the North Dakota Department of Health Facilities is the one that would do that. We also can't necessarily cross state lines, because those of you that are in nursing are well aware of how states don't play with each other, and you cannot cross a state line. So if we're taking 50 people across the state line to the other side of the metro area because it is the closest place to go, we can't send those healthcare workers with their individuals because they are not licensed in that state, and we have to go up the higher chains to get that resolved, or a clemency to allow them to do that. And then there's repatriation. So no matter what it is, if it's a flood, it's going to be 3 weeks later or a month later, or if it's a fire or a tornado, it will be a rebuilding process and take much later. But then we need to repatriate those, and we need to have a plan to bring them back, and that has to be a methodical process, because you can't bring them back before the facility is prepared for that, or the staffing is not prepared. And then in all of this, you have people that they age in place, so maybe they now need a more acute care. They have died, maybe they've gone home, that type of thing, or they're now in a hospital. So you need to follow all of that, and we would never want to lose anybody in the system, or lose them to a death because of the stress of being moved. So all of that has to go into play. These are people's loved ones, and we do need to take that into consideration, because speed is not the concern here. Life safety is the concern. We really, truly don't care about the building. It's been inundated, it's burned, the tornado is hit, the shelter is hit, the hospital is not working. What about life safety? It's number one. That is it in a nutshell. I could go down and drill down even further, but you would all be bored.
Okay. Thank you for that report.
Yeah, thank you.
Next item on the agenda is number 6, public comments. Is there anybody that would like to address the Board of Health that is in the audience? Okay. The next meeting is April 17th, 2020. This meeting is adjourned. Have a nice afternoon.